Good day everyone. Today we're going to tackle about the approaches, methods, and techniques in field trip, home visit, and community work. What is approaches, methods, and techniques? The term approach refers to a set of assumptions that establish beliefs and theories about the learner's natures and the learning process. And this is also the way of doing something, a path to get on that place. Next is a method. A method is a general term of presenting in a lesson a methodical manner using a specific approach. This is also provides the opportunity in learning the new exploration in other learning tasks from the different perspectives where the teacher is also a participant. Next, the techniques. Techniques are the precise action that take place in the classroom that are in line with the technique and hence with an approach. This is also the actual moment for the practice and behaviors to a particular methods. This is the way of delivering lecture to the student. So a field trip, this is an excursion is a journey by a group of people to a place away from their environment. When done for students, as it happens in several school systems. So as we all know, during our junior high school days, this is one of the implemented projects in TLE. Right? So field trip is divided into two, the natural and the cultural. So I am going to give an example in the natural. So like ecological fields, agricultural fields, and the zoo. The next, the cultural. So like for example, the museum trips, and also the historical place. Next is the methods of the field trip. So here, preparation activities and follow-up activity. Yes, this is a very important. Next is the students can select the place to be visited. The third one is developing question to ask, evaluating the experiences. And the last one, writing report or thank you letter after the trip. So these are the most important methods about the field trip. Next is the techniques of the field trip. Standardized methods employed to select, count, measure, capture, mark, and observe the individuals. Second, sampled from the target population for the purpose of the collecting data required to achieve the study. So, in additional, in field trip techniques, we need to expand the curriculum or to increase the children's knowledge in a particular area. And also, we're going to immersing children in the sensory of activities. Next slide will be discussed to Padilla Christally.
Hello everyone, this is Christally F. Tapasao, and today I'll be going to discuss to you about the approaches, methods, and techniques of home visits and community work. Okay, so home visit. Home visit is a service that is provided within the home of the families with their young children. A home visit is one of the essential parts of the community health services because most of the people are found in a home. Home visit fulfills the needs of individual, family, and community in general for nursing and health counseling. Home visiting programs are designed and implemented to support families in providing an environment that promotes the healthy growth and development of their children, Programs target their services to families and caregivers in order to improve child development, enhance schools readiness, and promote positive parent-child interactions. Although programs differ in their approach, population serves and intended outcomes, high-quality home visiting programs can provide development and family support services that reduce risk and increase protective factors. Home visit approaches. First is the foundation. The teacher home visit program rests on the school system desire to increase student academic achievements, increase parents' involvement, and motivate students to demonstrate more positive behavior in the classroom. And second is to examine medications error in the children. So, there are three methods in home visit. First is follow-up, second is home assessment visit, and third is illness visit. So, first is follow-up. Follow-up is the act of making contact with a patient or caregiver at a later specified date to check on the patient's progress since his or her last appointment. Appropriate follow-up can help you to identify misunderstandings and answer questions or make further assessments to adjust treatments. Also, the follow-up home visit is useful when significant life changes have occurred. For example, a home visit after the birth of a new baby provides an excellent opportunity to discuss wellness and prevention issues and to address parental concerns. A home visit after a major illness or surgery can be useful in evaluating the coping behaviors of the patient and the family members, as well as the effectiveness of the home healthcare plan. Next is home assessment visit. Home assessment visit can also be described as an investigational visit during which the physician evaluates the role of the home environment and the patient's health status. An assessment visit is often made when a patient is suspected of poor compliance or has been making excessive use of healthcare resources. Medication use can be evaluated in the patient who is taking many drugs because of multiple medical problems. Evaluation of the home environment of the at-risk patient can reveal evidence of abuse, neglect, or social isolation. Patients and family members who are trying to cope with chronic problems such as cognitive impairment or incontinence may particularly benefit from this evaluation. A joint assessment home visit facilities coordination of the efforts of home health agencies and physician. Finally, an assessment home visit is invaluable in assessing the need of nursing home placement of a frail elderly patient with uncertain social support. Next is the illness visit. Illness visit or the illness home visit involves an assessment of the patient and the provision of care in the setting of acute or chronic illness, often in coordination with one or more health agencies. Emergency illness visits are infrequent and impractical for the typical office-based physician. The techniques of home visit needs an observation, and this involves observing actual behaviors which are subsequently scored by the researcher deciding what to look for and how to decide what constitutes a particular behavior. Next is we will discuss the community work approaches, methods, and techniques. So, community work. Community work is a planned process to mobilize communities to use their own social structures and resources to address their own problems and achieve their own objectives. Community work focuses on participation and foster empowerment, emancipation, and change through collective action. Also, the focus of community work is the participation and foster empowerment, emancipation, and change through collective action. Community work is closely related to work for human rights. The community work process is about people in communities creating opportunities for growth and change. It is very important to do community work because it teaches us how significant it is to help the ones in need, the ones who are less fortunate than us. The importance of community service lies in the fact that it connects us to the community by improving it and making it a better place for all of us to live in. So next is, I have here 3 approaches in community work. First is community development, second is problem-solving approach, and third is a right-based approach. A community development is a process where community members are supported to identify and take collective actions on issues which are important to them. The community development practitioner empowers and resources the community members and creates stronger and more connected communities. Second is a problem-solving approach. A problem-solving approach is a technique people use to better understand the problems they face and to develop optimal solutions. Next is a right-based approach. A right-based approach is a guide interventions as well as assessments. Right-based social workers root their practice in their human rights, principles of human dignity, non-discrimination, participation, transparency, and accountability. Now, let's proceed to the methods of community work. So, the methods of community work is social casework, community organization, social action, and social work research. And that is the methods in community work. Next is the techniques. First is social casework. Social casework is one of the most important method and techniques of professional social work. Then, social action is about people coming together to help improve their lives and solve the problems that impart in their communities. Next is community organizations, refers to the organizations aimed at making desired improvements to a community's social health or overall functioning. Last is social research. Social research refers to the study of individuals and societies and is often used to identify regularly occurring social patterns in social life.